Hello, my name is Adela Maria Adela Tamayo. My research project is on fibromyalgia, which is an illness, and language learning and how it can affect language learning. My research question was, can illness affect language learning? More specifically, can an illness like fibromyalgia, which causes pain, and they say that fibromyalgia is actually can be caused by trauma or even other illnesses, and it becomes a chronic condition, can that cause language loss for someone who has already learned a second language? And since this is second language acquisition, I looked into, can it also affect the way a person learns a language? My main idea was during the second week when we were talking about variation and the things that can affect our linguistic knowledge and vary the way we speak. We talked about individual characteristics such as gender and age and motivations and strategies, and I emailed Dr. C to see if one of those individual characteristics could be an illness. Because when you have a chronic illness, it's an everyday thing. So it becomes a part of you, a part of your life. So I put how I wanted to look at strategic competence, which is part of communicative competence, which strategic competence deals with what does a person do when there's a breakdown in the language. So in this case, when you can't remember the word, or you know the word, but you can't remember it. There's our linguistic knowledges is what we know, what learners know, how it's structured and where it's stored in the mind. And then we have individual characteristics such as gender, age, motivation, strategies that can affect linguistic variation. So can having a chronic illness be an individual characteristic since it becomes a part of you and it's an everyday thing? I use communicative competence from chapter 1 in the Giesland and Long textbook, and how Canal and Merrill Strain in 1980 talked about how there's 3 different types of ability when it comes to communicative competence. We have grammatical, which means we need to be able to use the lexical items, the rules about morphology, sentence structure, and sound system. We have social linguistic, which means learners need ability to interpret speech in social conditions and for the actual social meaning and not the literal meaning, because sometimes there's a social meaning too, and what is appropriate. So that talks about the intended meaning. And then there's strategic, which is the way learners compensate when there's a breakdown in communication. And for example, I looked into if fibromyalgia can cause aphasia or a breakdown in communication, how can learners or speakers deal with this? And I looked into how maybe that could be a future study of how there could be like specific learning strategies that could help someone who's struggling with this breakdown. The approach to learning, this one was kind of hard for me to decide. Like, I couldn't decide, should it be social, should it be cognitive? I kept finding all these approaches that would fit. I found how structural could fit into how our brain works and where it could be stored, especially as I kept reading articles about fibromyalgia and language learning and about how illness, it was kind of hard for me to decide which one. I finally decided on socio-cognitive. Socio, or the social, because as someone who struggled with language because of my fibromyalgia, the first time I noticed it was because I was having a conversation and I literally forgot a word that I know. And it was just like, I could see it in my mind, but it wouldn't come out. So I feel like that's something that the language loss you would notice in a social environment. You notice when you're interacting with another person. I also noticed it one time my mom asked me where something was, and I was trying to tell her it's on the kitchen counter, but I could not say kitchen counter. All I could say was, it's over there on the flat white surface. And it frustrated me because I was like, no, wait, that doesn't make sense. But in my head, I could see kitchen counter, but I could not say it. I looked at conjunctive because fibro can affect the brain and cause cognitive difficulties. And so I looked into this approach of learning. Dwight Atkinson saw that the social and the cognitive interact with a system to make up the mind, the body, and the world. That's supposed to be world. The approach to learning, the cognitive, which is our mind, adapts and our thinking changes. So if there's an illness that causes a change in our body, that could even cause a change in our brain, such as, memory loss, how does that affect when we learn? And mind, it says the mind or body or mind and world combine. And it says the individual aligns through interaction that also includes physical behavior such as posture, and gestures. And they brought up the fact that when we're in pain, we can literally change the way we act physically to deal with pain, from the way we stand to the way we're sitting to what we're doing, but even the way we talk, because someone can look at our face and be like, oh, are you angry? Are you mad? And it's like, oh no, it's just, I'm in pain. But it's a constant thing. Social cognitive says learning can't be separated from your surrounding environment, which includes your physical target language or the classroom. So I wonder if learning can't be separated from us having to deal with the physical aspect of always constantly being in pain. What is fibro? One article was that JAMA Claw MD wrote how it is the second most common rheumatic disorder. 2 to 8% of the population that have fibro, or almost 2 to 8% of the population have fibromyalgia. Almost all are women. It can develop at any age, even in children. I'm in a fibromyalgia support group, and I was 27 when I was diagnosed, but I have met women who were diagnosed as young as 17, and I've also met women who now have children, and they were diagnosed when they were older, but they're actually starting to see the symptoms in their children. Fibromyalgia patients can have a lifelong histories of chronic pain throughout the body, such as headache, dysmenorrhea, which is actually cramps or pelvic pain due to menstruation, which is, as someone who had heavy periods due to polycystic ovarian syndrome, I would have painful periods. There was also talked about the temporomandibular joint disorder, which is pain or compromised movement of your jaw joint and surrounding muscles. Endometritis, I've met women who suffer with that, and that's when the tissue from when we have our periods actually goes around other organs too, so you're in a lot of pain, and back or neck pain. It's considered a centralized pain disorder because you could have pain in all areas of your body, and sometimes it's only one area, and sometimes it can actually be multiple areas at one time. We have a tendency of failure to respond to opiates. I've noticed that, and I met other people when I was going through my diagnosis, and I would wind up in the emergency room, and I couldn't describe some of the pain symptoms, but when they would give me like morphine or other pain medicine, it would last like an hour, and then the pain would come back. And then it says operations to reduce pain. I had to have a spinal block for pain, and instead of lasting the 3 to 6 months it should have lasted, it only lasted a month on me, which is how the doctor found the scoliosis. There's also a family history of chronic pain. My father has chronic pain due to his back injuries, and so that's something that could be looked into, whether this runs in the family. Maybe it also affects learning. What is fibro? They also found that there's environmental factors which can trigger, such as stressors, such as acute pain lasting longer than a few weeks. Because they're saying there's temporary pain, which, oh, you got a headache, it goes away. But then what if that headache keeps coming back? And even though it stops for a little bit, but it keeps coming back, or your pain lasts more than a few weeks. It talks about infections such as Epstein-Barr virus, Lyme, Q fever, viral hepatitis. And I was also wondering if infections would also be strep, because one of the things when they were testing me for fibromyalgia was they found that I was a strep carrier. It says trauma, such as car accidents. I was in a really bad car accident. War. There's also psychological stressors, which results in fatigue, memory problems, sleep or mood disturbances, because they say the same neurotransmitters in our brain that can control pain also control these as well. And so they might, since we're having pain, it would also control how we do with these. Normal touch feels painful, and that was the case. And someone could just touch me and it would hurt. A hug, taking a shower, my clothes, it was painful. It says psychiatric disorders, depression, anxiety, OCD, obsessive compulsive disorder, and post-traumatic stress disorder. It says you can develop cognitive factors such as catastrophizing, which is thinking about pain, so there's negative consequences, and or fearing movement, which I went through that before they actually diagnosed me with fibromyalgia. I was almost scared to do stuff because I knew it would hurt. And then even after the diagnosis, for a little bit, I was scared to be active. I was scared to play with my nephews and nieces. I was scared to do stuff with my family because it was like, oh, this is going to hurt. And it can become a fear that you have to deal with. There was an article for What is Fibro by Jay and Barkin where he talks about how it's a disorder that has one or more symptoms. And it was. I like to tell people that before it was like I felt like my whole body was falling apart, and I was going to like 6 different doctors. They were trying to figure this out. It was like I was becoming allergic to things that I ate. I couldn't wash my hair with shampoos because it would get itchy and painful. I was having all these pains. The emergency room doctor told me I was going through early menopause. It was just all these symptoms, so it was hard to diagnose. And so because of this, and because there's no actual blood test, which just says no gold standard, there's no blood test that will say, oh, you take this blood test, you have fibro. Many physicians don't actually believe that it's real. And in Europe, they do not actually recognize this as a diagnosis, so there's not actual medication that would help it get better. In the United States, it was just a few years ago, it was the same way. It wasn't until maybe like 2 or 3 years ago that they actually said, this is an actual diagnosis, this is what we think causes it. And now you're start seeing commercials where they're saying, oh, Lyrica can help with fibromyalgia. The first time it was really out there was 1904. It was actually called fibrositis, and it was caused by muscle pain secondary to inflammation. The first controlled study was Eunice et al., which they found multiple symptoms: pain, poor sleep, fatigue, paresthesia. Paresthesia is like the pins and needles, like when your foot falls asleep or your leg falls asleep because you're sitting too long. When that would happen to me, it would happen almost like nothing was causing it. I actually wasn't sitting too long or, covering my hand or there was no pressure causing it. It would just like randomly happen. My legs would start feeling pins and needles and it would hurt. Another symptom was IBS, which is irritable bowel syndrome, and headaches. They say the fibromyalgia can be primary, which that's the primary illness that you have, and they also have concomitants, or in some of the articles they kept using the word comorbid. And at first I was thinking, oh, so it's going to cause you death. But when I looked up that word, it actually means that you have 2 illnesses and you have them together at the same time. Once again, there's no gold standard test. There's no, here's a blood test, you have it. It affects the ages between 20 to 40. Since the millennium, they actually have considered that it's a central sensitivity syndrome that has to do with our central nervous system and the neurophysiological. the way when they finally, I read an article that a couple of years ago when they finally said fibromyalgia is an actual illness or an actual syndrome, they actually said that they think it's the way our brain processes pain, and that our pain cell receptors have been set higher, and they're still trying to figure out why. So we process pain differently than other people. So things that normal people can handle is painful to us. So, but actual pain would be even more amplified. They also say it's a neurosensory disorder, which difficulties in pain processing by the central nervous system. This is a look. When I did my survey, I did a Google form that they could fill out. This lists what we like to call fibro fog and how that affects our mind and how our brain will feel all foggy and the things that it makes us feel, they call it fibro fog. There's forgetfulness, memory lapse, mental confusion, blurring of mental clarity, sensory overload, distorted sensory perceptions, word mix-ups, reduced verbal fluency, diminished ability to concentrate, think, or process information, follow a conversation, mind feels like a mind full of cotton. That's kind of like the fibro fogginess, with the life living through a haze. You almost feel like you're walking through life in this haze that's constantly there. There's no rest and there's no stop. This I found in one of the articles that lists this would be something that doctors could use, or even researchers about. They have the patients check off. If you look at the body where it shows the different sections, that would be the different sections where they find that the most people who have pain and how long you've had pain. And also because when they're testing us, they do something called a trigger point test. So in parts of your body, there's certain trigger points like right here or right here, or even I remember them touching my stomach and then under your knees. And so they would touch us there and they would tell us, does this feel painful? And then they would say, if you have pain in a certain amount of areas, that's a sign that you have fibromyalgia. Okay, this is where I talk about the aphasia. I kept saying language loss, and then I was thinking, is there an actual word for language loss? So I looked that up, and in the medical, there's aphasia. There's also one called dysphagia, but dysphagia actually has more to do, there's damage in your mouth, where aphasia from the National Aphasia Association says it's an impairment of language affecting production or comprehension of speech, ability to read or write. It happens due to injury to brain and most commonly a stroke. When I was talking to my aunt, who's a teacher, about my project, she brought up how she actually knows this teacher who's really young and she had a stroke. But that after the stroke, she only speaks one of her two languages. So she knew both English and Spanish, but now after the stroke, she only speaks in Spanish. And so she'll understand English, but she can't speak in English. She will only speak in Spanish. And it says that aphasia can be caused by head trauma, also, or brain tumors, or even infections. It can affect a single aspect, such as your ability to retrieve names of objects, put words together, or your ability to read. It can also affect multiple aspects. This is the diagram that they have online, because there's actual varieties and special features of aphasia, because they're trying to say that the aphasia or the language loss can be affected by where the location of the brain injury is in the individual cases. So that could cause different types of language loss. For example, they said global aphasia is actually the most severe form. In that one, the patients can only produce a few recognizable words. They understand little or no spoken language. They can either read or write. And this can be seen right after they've suffered a stroke, but it can also improve if the damage has not been too intensive. They have found, though, if there's lasting or greater brain damage, it will actually be more severe and lasting. There's also, when I was doing some of the research on fibromyalgia and aphasia, they also brought up the Broca's aphasia, which they call non-fluent aphasia. This is more about speech output is severely reduced, is limited to mostly short utterances or less than 4 words. Your vocabulary access can be limited. The formation of sounds can be limited. It also talks about the sounds can be like laborious and clumsy, and the person may be able to understand speech and will be able to read, but is limited in writing. And this is non-fluent aphasia because it halts and it affects the quality of speech. There's the mixed non-fluent aphasia, which is another one on there. It talks about they would have sparse and effortful speech. So they have to put in an effort to make speech. It resembles severe Broca's aphasia. It says, however, unlike Broca's aphasia, they remain limited in their comprehension of speech and they do not read or write beyond an elementary level. The next one is called fluent aphasia or Wernicke's aphasia. In this form of aphasia, you can have the trouble to grasp the meaning of spoken words, while it says the ease of producing connected speech is not much affected. Is referred to fluent aphasia because speech is far from normal. Sentences do not hang together. Irrelevant words are intruded into the sentences, sometimes to the point of jargon. It says in severe cases, reading and writing are often severely impaired. The next one would be called anomic aphasia. This is the inability to supply the words for the very things they want to talk about, particularly the significant nouns and verbs. This can also affect the fluency in grammatical form, and output is full of vague circumlocutions and expressions of frustration. They understand speech well, and in most cases read adequately. They have difficulty finding words as evident in writing as in speech. The next one is called primary progressive aphasia, which is a neurological syndrome in which language capabilities become slowly and progressively impaired, unlike other forms of aphasia that result from stroke or brain injury. So this would be like Alzheimer's disease or frontotemporal lobar degeneration. This, because the brain is actually deteriorating and the brain tissue is deteriorating, that affects speech and language. The first symptoms are usually problems with speech and language. Other problems associated with underlying disease, such as memory loss, and often occur later. There's also other varieties that they've talked about. There's actually many combinations of deficits that do not fit into these categories. So some components of complex aphasia syndrome may also occur in isolation. There's cases of disorders of reading where they call that alexia, or disorders affecting both reading and writing, which is alexia and agraphia, following a stroke. Severe impairments of calculations often accompany aphasia, and yet in some instances, patients retain excellent calculation in spite of the loss of language. So, and I noticed in some of the research they do about fibromyalgia is it talked about which part of the brain would fibromyalgia affect that could actually cause the loss of the ability of the language, and also what part of the brain is the language stored in, and is that part damaged. And that's one of the articles that I'm going to mention is, are fibromyalgia patients cognitively impaired? Tesso, Torter, Colonial, Limroni, and Chicato et al. We're looking at how fibrofog, and they called it a cluster of cognitive disorders, does not always show up in medical testing, but it can still affect work and daily life. And how one of the sources that they use, the Badarluki and the Ovaria, found that 50 to 80% of fibromyalgia patients actually decline in working memory, attention, and executive function. So the study was addressing how they wanted to look at the neuropsychological performance of fibromyalgia patients. In short, long-term memory, working, and executive function by comparing them to healthy, pain-free patients. And they also wanted to investigate how the objective performance on testing, and they used different tests and they used different studies. They used medical testing, and then they also had the patients do a self-perception of their own cognitive skills. And so they wanted to look at the relationship between that. They found that fibromyalgia patients were more impaired in long-term memory, attention shifting, and updating. They did find that they have a significant slowdown in reaction time, which previous studies showed there is a slowdown in response processing. That patients were slower in trying to select a target that was similar to the stimulus that they were being showed. There was also an impairment in shifting. There was an underlying problem of mental processing speed and psychomotor speed. It did not show an impairment in verbal fluency, which actually counteracts the previous studies, because there's one study by Glass that found that several studies show fluency disturbances. The one thing they did bring up was how there was a limit to their study because medication that were given to treat fibromyalgia or other symptoms can actually affect cognitive function. So it may be difficult to say, is this caused by fibro? Is this caused by an illness? Or is it caused by the medication that is being taken? My methods for my study was a case study. I had 3 participants, maybe one more because I have one more lady who may be filling out the interview. I did the interview on Google Forms. I used open-ended questions about each section, and I had a symptoms checklist where for the sections where there were symptoms related more to that area. I'm the first case study because at first I only found 2 people who could fill out the interview. So I'm the third case study. And then I might have possibly found one more, but she's still filling it out. So my diagnosis was at the age of 28. And the way I was diagnosed, it felt like forever. It felt like probably a year after I was in a really bad car accident. I started having a lot of allergy attacks to food, to food, to flowers, to shampoo, everything. The pain would start. Sometimes I would feel like ants were crawling up my back, and I would go ask my mom, "Are ants crawling up my back?" And she's like, "No," but it was painful. And taking a shower was hard sometimes because it would feel like little needles hitting my skin. And when I would go to the doctors, I would often feel like, because I didn't know how to describe the pain, that I wasn't taken as serious as, oh, it just hurts, or it feels like this, or it feels like a muscle cramp, or because it was almost everything. I would have cramps, I would have pain in places where I'd had my surgeries before, because I've had 2 back surgeries. So my symptoms were I've had widespread pain. I would literally feel like my whole body was in pain. I had stiffness, fatigue, non-restorative sleep. I've always suffered from insomnia, even when I was in college. I had the unexplained symptoms, which was like the ants crawling on my back, feeling like I was getting allergic to food that I had just eaten the day before and nothing happened. I've suffered from anxiety and depression for a few years. So I don't know if that's connected to fibro. And I also lost the ability to do everything things because everything hurt. And so I was trying to do my master's online, and sometimes even typing, like my mom would call me the little viejita, because after I would type, like the little old lady, because she would cover me up with blankets and she would put pain patches on my hands to deal with the pain. And I put that currently I still have symptoms less with medication, but I have more cognitive symptoms. It's secondary because I've had surgeries before the fibromyalgia. I have had the car accident. and I had irritable bowel syndrome before fibromyalgia, but I wasn't found to have hypothyroid until after fibromyalgia. For my fibro fog, I can tend to be forgetful. I can have mental confusion, sensory overload, word mix-ups, diminished ability to concentrate. Mind feels like content, and it's sometimes hard for me to follow a conversation. There's no official aphasia diagnosis because I've never gone to a doctor and they've never like studied my brain. But I'm not sure if I've actually had brain injury, because that's one of the questions that I asked is, have you had a brain injury? Not sure, but I've had 2 back surgeries. So I know that can affect the central nervous system. Plus I have scoliosis. I have post-traumatic stress disorder because of a car accident that I had a few years ago, and also because I've had multiple surgeries since I was a kid. My first surgery was when I was 6. By the time I was 18, I had 3 surgeries, because 2 for my ear. I've always had ear problems and ear infections, and 1 was my back surgery. And then after I was 18, I've had 3 more surgeries, but I guess 2 more surgeries before I was diagnosed with fibromyalgia. My first language is English, and I learned it at home and in school, and also I had to take special classes for dyslexia. And sometimes when I think of my dyslexia classes, I think it was almost like I was relearning English, because I knew how to speak in English, but I would struggle reading in English. And my second language is Spanish. I'm more fluent in reading it and writing it than actually speaking it. I need practice. And I learned it at home with family and at school, because I took classes both in high school and in college. And I learned both of them before fibro. So I couldn't answer, because I had come up with 2 questions that said, how did fibro affect you after, if you learned your second language after? So I haven't actually noticed a difficulty in learning a language, but I've noticed troubles when speaking or trouble concentrating on reading for classes. I'm nervous because I would really like to try to learn Chinese. And my language lost story would be with my mom, how I couldn't say the word kitchen counter, even though I knew it. And I've also noticed it while I'm having conversations with people and I'm talking about something that I was just thinking about, but now I can't bring up the words to talk about it. My first case study, I call her AP. Her age of diagnosis, and I know her, she is actually a missionary and she's been to a lot of different countries, and her age of diagnosis was age of 18. She had a serious head injury, and she went to numerous doctors before she was diagnosed. Her symptoms before her fibromyalgia diagnosis were widespread pain, stiffness, fatigue, non-restorative sleep, cognitive difficulties, anxiety, depression, loss of ability to do everyday activities. She said that it was secondary, not primary. Other conditions that she has are chronic fatigue syndrome, PTSD, and POS, which I put a question mark. I'm going to ask her, because when I looked up those terms, POS could be polycystic ovarian syndrome, because when I found that. Fibro fog, she said she dealt with forgetfulness, mental confusion, sensory overload, word mix-ups, reduced verbal influency, diminished ability to do everything, to do everyday things, follow a conversation, no aphasia, like no actual diagnosis. She said yes to the brain injury and that it affects the way she communicates. Her first language is English, and she was raised speaking it. Her second language is Spanish. She used programs such as Duolingo and Rosetta Stone and Cultural Immersion. Her other language is Pidgin, Slavic Russian, and she learned from friends and family and programs. Before fibro, she was learning bits of Spanish. After fibro, she learned Spanish, and she's currently working on Russian. After fibro language learning, she noticed that before fibro, she would actually remember more. And now she feels like she has to repeat a lot before it actually sticks. Before the fibro learning strategies, she said that, well, she didn't really have strategies, mostly because she felt like it was easier to learn because it was like how a child learned. She learned from her friends who spoke the language. Language loss. Yes, she says she hears the word in her head, but she can't say it, or she'll see it in her head, but it won't flow out. Feelings toward language loss. She says she feels frustrated and she feels stupid. Didn't notice before diagnosis if she ever dealt with language loss, because that's one thing I mentioned. I've had people who don't have fibromyalgia say, oh, that happens to me too. And yet I noticed that it would happen to me too before, right? If I was feeling stressed out or overly tired, but I feel like it wasn't the same after I got fibromyalgia. So I wanted to know if they noticed any type of language loss before their official diagnosis. Language loss with fibro, that it feels frustrating. Language learning can feel extremely difficult. She's learning Russian, but she's dreading it because of the difficulties. She says language use, fibro affects her first language because she often can't find the right words. Her grammar is off. She struggles to spell simple words like cat. For her second language, she noticed that she struggles with sentence structure and words that are similar to each other, that it affects her state of mind, that she dreads the long process of learning a language, and she has frustrations of language learning. But she did leave another other comment on her, how she talked about that she felt like the skill and the use of being bilingual or trilingual is actually worth it, even if it's hard or frustrating. She says she sees it as an ability to communicate and become a part of someone's life, and unique, beautiful opportunity worth fighting for. The case study 3, BS, I used her initials. Her age of diagnosis was 36. Diagnosed by a family doctor, then she went to a rheumatologist who confirmed through the tender point exam. And when they do the tender point exam, like in my case, they did it multiple times over a period of a year, because they actually want to see if the pain is chronic and not just a temporary thing that happens. Her symptoms before are widespread pain, fatigue, non-restoration sleep, cognitive difficulties, anxiety, depression, loss of ability to do everyday things, still present after diagnosis. She wrote that it's secondary to chronic fatigue syndrome and Ehlers-Danlos syndrome. Ehlers-Danlos syndrome is a disorder that affects your connective tissue. So you can be overly flexible, joints, elastic skin, and bruise easily. She has found that fibro is actually a pain symptom of Ehlers-Danlos syndrome, and she had IBS before fibro. Fibro fog. She dealt with forgetfulness, mental confusion, sensory overload, reduced verbal fluency, diminished ability to concentrate, living through a haze. She has no diagnosis of aphasia. She said no to brain injury, but she said she did have a concussion as a child. Her first language is English, which she learned at home. Her second language is French at school. She learned both before fibromyalgia. She said her learning strategy before fibro was she lived in France for a few weeks, and she felt that immersion in the culture is what helped her to learn. She put yes to language loss and that it feels frustrating and embarrassing. Didn't notice it before fibro. When she experiences language loss, she feels like it's a part of the brain fog, trouble speaking in conversations because she can't communicate clearly, and she avoids talking on the phone. She says it affects her first language a little in the way that she has trouble remembering words, finding right ways to communicate my thoughts. She feels like it doesn't affect her second language, and she's able to communicate with her son, who's learning French right now, and speaks with her daughter at home, and every once in a while has to look up vocabulary. She does put that she's no longer fluent in French, but due to not using it, but she feels she would be able to pick it up if she was immersed in the culture. Yet she says she's still able to respond and translate in her head first. Does fibromyalgia cause aphasia? I think to diagnose the actual aphasia, you would need to be a doctor, and you would need there would need to be brain imaging and scanning and to see if there's actual, especially because in some of the articles I read, there's actual criteria that has to be met in order to be considered aphasiac. I think that's how they called it. But the case studies show that fibromyalgia can cause trouble with language. I think further study is needed on whether it is fibrofog or whether it can be the medication that we take. They can be actually causing these cognitive troubles. Because some of the medications that I take can actually make me very sleepy and drowsy. And so sometimes I wonder, because even if I do get some sleep at night, I have trouble thinking. And for some, it still works trying to learn a language, even if they have trouble learning it. Okay, thank you.